Bapak dan Ibu, acara akan segera kita mulai. Ladies and gentlemen, we shall now begin our agenda today. Honorable Professor Dr. Rainier Soburn from the Institute of Public Health, University of Heidelberg. Honorable Dr. Insinyur Agus Mariono, Magister Engineering, the Deputy Director of SEAMOLEC. Honorable Dean, Vice Deans, or the representatives of Indonesia University Consortium from Diponegoro University, from Andalas University, Mula Warman University, and Jenderal Sudirman University. Honorable Dean and Vice Deans of the Faculty of Medicine Universitas Gadjah Mada, eminent professors, workshop participants, and all other distinguished and honored guests. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. On behalf of the Universitas Gadjah Mada and the Faculty of Medicine Universitas Gadjah Mada, I warmly welcome you today, this morning, to the faculty, and I wish you a good day and a fruitful workshop for today. And I believe that today is the second day of the workshop on University Consortium for Global Health. So this workshop is one of the pathways toward the establishing of the Inter-University Center on Global Health. A highlight for today's agenda, ladies and gentlemen, the event will be started by the panel presentations and the discussions from the representatives of each theme that has held discussion yesterday. And we will continue with a short coffee break, and then Professor Rainier Soburn will have his comments on the presentations and the discussion. And then there will be presentation of follow-up actions from several parties, and then we will have the closing remarks later in the afternoon. So, honorable guests, ladies and gentlemen, without further delay, we shall begin this event with the panel presentations and discussion session. And this session will be led by Dr. Wirsma Arif Harahap from Andalas University as the moderator. So may we invite Dr. Wirsma Arif Harahap to lead the presentations and discussion, please. And I would like to also invite Ibu Eri Wahyuningsih from Jenderal Sudirman University to be the secretary of this panel. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Good morning, ladies and gentlemen. Dear our distinguished guest, Professor Rainer, dear professors, and all of my colleagues. In this session, we will discuss about the presentation, the result from our discussion for yesterday. The topic is about the institutional first, and the second about the climate change, and the third about the non-communicable disease. For discussion, I think the time is enough. It's about 2 hours, and I would like to call from the group C first. I don't know. Yes, from the E because the schedule is from group C. I don't know. Okay, I'm so sorry. From the group E, please. The person that's responsible for presentation, please come forward. Group E, climate change. Yeah. Group B, please. We're still waiting from Group E, and Group B, please come forward for the institutional, for the NCD. Please. Yes, it's okay. You can present from It's depend on you, Professor. You can. Okay. Professor Sofia Mubarika, time is yours, please. Thank you.
Thank you very much, moderator. Good morning, everybody. Because I'm the oldest of the team yesterday, so I was appointed as a presenter after the discussion we have had yesterday. So I'm very sorry that we have maybe a little bit using according to our understanding, but according to Dr. Budi, should be Global Health Consortium on something. But anyway, this is just the title. So from NCD, our team represented from Sudirman Faculty of Medicine, Faculty of Medicine Andalas University, from Mula Warman University, Faculty of Medicine, and also from Diponegoro Faculty of Medicine. And this, what I presented on behalf of the team is the result of the discussion highlighted from the prioritized research agenda from prevention and control of NCD according to WHO 2011. Next slide, please. Emphasizing what Dr. Agus Mariono mentioned yesterday about Southeast Asian SEAMOLEC, aim to develop inter-university center through education and research quality improvement through open distance learning with 11 and maybe later on more, not only Asian but also from other countries. And the vision, if we may remind all of us, the Indonesia SEAMOLEC is to collaborate and accelerate Asian development through open distance learning. So this is the vision, the dream, and the mission is how we can achieve that. So the mission is to capacitate human resources through education, research, and services, and started with DebSwap 1 through Master and PhD program, and DebSwap 2 started next year, 2014, until for 10 years for 3 points. Next slide, please. Yes, and from this mission, also the aim is to have Asian connectivity. Asian will be started in 2015. So it means that in these 2 years we have to have some mission to have ODL started in 2015. Okay, next slide, please. So for this DebSwap 2, we propose to have 3 points according to the scheme that have been given from Dr. Agus. First is the capacity building on human resources through education, through master and PhD program. We focusing on non-communicable disease. We haven't calculated yet, but I hope that Dr. Wisma Arif maybe can have some more information according to the budget available. So we will calculate it to be put on the proposal. And then secondly, is strengthening research and education through exchange professor, associate professor, doctor, or postdoc, vice versa, to develop curriculum, to standardize the curriculum, and we aim to have a credit transfer system to support the open distance learning between Asian countries as well as between our collaboration with Germany institution. And then secondly, with research, international research proposal for the staff to as a sustainability toward multi-center education and research. And third, laboratory development to support sustainability in facilities as well as lab certification of the laboratory itself and also the manpower at the laboratory. And according to the development of science and technology that grow very fast, so we have also to fulfill all of the need facilities that support the research on genomic, proteomic, metabolomic stem cell, as well as in community field research. In addition to that, international conference and publication also one of the items that will be put in the proposal, and also how we get to start the research collaboration is through some seed grants to start to the staff to develop the proposal through workshops. And then for the non-communicable disease, because it's much related to genetic aspect that are very, very specific between ethnics and between countries, so we also need to develop genetic counseling and surveillance data to support all of the needs for the research activity for the postgraduate program. And then we start to open distance learning for from South to East Asia, and how we conduct the education is through joint supervision, and also we need to have clinical and public health training. Next slide. This is the structure of NCD based on WHO 2011. So consists of 4 main problems. The first is cancer, second is cardiovascular diseases, third diabetes, and fourth is chronic respiratory diseases. And to end up with health service in delivery, in equity and quality in health services, so we will do from bench to bedside through translational research. And the points we raised for all of those 4 problems is on prevention. So there are items have been guided from WHO, and we have discussed thoroughly the items in the prevention, and we all agree we put in this presentation as pointers that can be used for students as their title for their master or PhD programs, their research. Okay, and first is prevention, and then the second, next slide, is early detection. So early detection should be early detection that related to cost effectiveness, biomarker, but cost effectiveness for Indonesia. Okay, I think we don't need to have going in every points, but it's already there, and this will be as a, what do you call it, as a umpan itu apa bahasa Inggrisnya, as a trigger for research title of the student for master and PhD program. Next slide. Third one is about treatment and palliative care. This also mentioned item that have been discussed thoroughly since yesterday. And we also included the universal health coverage in this item. Next slide. Okay, and then at last for this item is national control program. So hopefully with the directive target of WHO at the end, all of the research can have something to contribute to national control program, to cancer burden and social and ecological determinant, improvement in cancer registration, and then data for prevalence of major risk factors, identification of local successes, for example, in downstaging and treatment that have been already there according to the experience, our experience in collaboration with Yayasan Kanker Indonesia, National Cancer Foundation. Okay, this is for cancer. And also training for health professional in all aspects, and also at the end will influence to the advocacy to the decision making process. And then for the cardiovascular disease, for diabetes, and for chronic respiratory disease, we will do the same. And this item will be given to all of you in the form of copy, so we can use it as a point to trigger the topic of research. I think that's all from the NCD. But if there are something left that we have had yesterday, please, I invite the team to give some additional information. Dr. Susan, Dr. from Sudirman. Is there anything left? If Dr. Susan, Dr. Puyaya.
Thank you very much for the forum. I would like to suggest to add only a little bit of detail for facility. If we can add also biobanking as part of the supporting system in each for the structure of the research, it can be. I think it can be good.
Okay.
Thank you.
Yeah, I think I absolutely agree that we need to have biobanking to support of the research for NCD. Yeah. Dr. Uco?
Thank you, Professor Sofia Membarika. The nice presentations, but I think we open for 3 questions or suggestion for these sessions. Is there anyone to give the suggestion or question for this session, please? Because for the topic for our program is according to the WHO that give from Dr. Yodi, and I think it's too large, I think, for the research. We have so many choice. It's depend on the researcher or the laboratory to develop the capability of the research. I think that's enough, Professor Rika. Thank you very much. I think we continue for the group A. Please applause for the Professor Rika. For the second speaker is come from the group E, Professor Rainer. Here. Oh, please, my neighbor.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, dear colleagues. After the presentation from Professor Rika, I would like to continue to present our, can we say that it's the result of our discussion yesterday we had with Professor Renner. The basic information of the consortium already explained by Professor Rika, so I'll go directly to explain what we discussed yesterday. From the cluster of climate change and human health, we use this framework as the basic of guidance for our work and our step to be taken. It's already reviewed by Professor Reiner. Next, please. Oh, okay. We'll start our work with the measurement of health impact and identify the most vulnerable groups. And we'll continue with the next step, which is adaptation and cost. And then take the step of evaluation to the intervention for climate change impact. So finally, we can produce a policy translation to achieve our main goal, which is decreasing human health vulnerability and improving public health adaptation to climate change. However, this step cannot be taken directly. For example, from the after we do the assessment of health impact and identify the most vulnerable groups, we can go directly to the policy translation. And so we can produce the policy translation without waiting for those 3 steps taken. The step of doing that will be done by doing research, capacity building, and community engagement. And the whole process will be the knowledge generating from the researcher into the community. Next, please. And this is some reviews we've had from the discussion yesterday. From the framework we displayed previously, Professor Renier suggested us to make a research agenda to compress impact, adaptation, and policy. But then we need to we need to collect more adequate data so we can select a few topics that we can focus on. And the initial suggestions are the data of malnutrition, infectious diseases, heat, and injuries. For that, we will need to, this data will be needed to map the climate relevant resources inside and outside the consortium members. And from those data, we can use to make the model and projection of climate change impact on health for prediction in the future. Initial discussion led us to make a study site of the SPICE project already done by UNSUD with the University of, but we discussed it yesterday, yeah. Purworejo and Semarang, yeah. Okay. We identify some condition that can help us to do that. We also suggested to take some pathway. We need to identify first the data, so we will need the public health laboratory also for the whole NCT group. And those 2 sites recommended is Purworejo and Semarang for urban and coastal area. Next, please. And the subgroup analysis of particularly vulnerable groups are elderly, children, urban, based on location, etc. And these are some key competencies needed. This is for the entire member of the consortium. We need to be empowered ourselves in communication, writing proposal, negotiation, teamwork, English competency and also teaching how to teach. Professor Yati is supposed to be explain more about this. Unfortunately, she couldn't join us today. Next, please. And we also need to discuss at least these two things. The financial incentive for researchers based on proposal acquisition, publication, and teaching performance, and also research ethic. Next, please. For the sustainability program, we identify that we can do it by making the junior group of researcher, which is work independently, and also we can do the link of research to teaching and policy. That's the presentation from our cluster. If there's any other information I haven't mentioned, I invite the other member of our cluster to give us additional information. Thank you.
Thank you very much for Eri Wahyuningsi. Is there any question or any suggestion for this session? Please.
Just to share information to Professor Reiner and all of us. Recently, we had a visit from the UMU University team. Prof. Stigwell came here and the team. And one of the agenda in that visit was to set up a site in Yogyakarta province for NCD surveillance. This is, I understand that Purworejo has been a long-term site, and this is also part of the in-depth network. But there is a plan to try to set up selecting one district in Yogyakarta, especially for NCD, for surveillance of risk factors of NCD.
That's the third. I mean, we have now three candidates. That
Right.
is the existing site. We thought it's a good idea to build
Yeah.
on what's
Yeah.
already there.
Sure.
And then this site, which will be a demographic surveillance site, like Purworejo.
This will be mainly for risk factor surveillance, NCD risk factor surveillance.
But an entire population, which is
Population based. Yeah, population based.
death and
Yeah,
migration.
yeah, population based in one district in Yogyakarta province.
Well, you know, the main point that we wanted to make is, and I hope I speak for the group, that we have such sites. Where they are is then a matter of discussion, of course. We just thought that Purworejo is a nice candidate because the expertise is already there. And from the climate angle, and it should be for both. I mean, I don't think it's a good idea to have one for NCDs and one for...
Yeah.
The population is a population, they suffer from everything. And one should not have specialized, that's my view, specialized only NCDs and only... That's also a waste of money because the whole operation to entertain this is quite demanding, and you can do the same, have the same population and do risk factors and do climate change relevant research, and it's also a nice integration tool for the two groups.
Yeah.
So my take on this is wherever you choose, it's fine. From the climate angle, it would be nice to have urban-rural, and I think also for the NCDs. If you have two, to carefully select where you put them. I mean, we suggested Sydney one,
Semarang.
which is coastal, and you have a lot of exposure to coastal flooding and so forth, and it's an urban side too. So I think we should put up a list of criteria where we think these sites should be. But the main thing is that there are sites and that they're used by children.
By all means, I'm not saying that this to replace. It's just a discussion that has been recently ongoing also. Of course, it would be... No, Sleman district. Yeah. Sleman. Yeah, we wish to have two districts, one urban and one rural district. And the rural district is very near to Purworejo. In fact, there are these two are next to each other, which is Kulon Progo. But I mean, this is still a very early discussion, and I think it would be great to have more sites. Yeah, to bring it together.
It's rural and urban, you said.
Two different districts.
Yeah,
One to rural, one to urban. But it's one
province in Yogyakarta where we
it's one DSS. I mean, it's two different populations but run by the same team.
Yeah,
That's it.
that's great. That's
Very
great.
nice idea.
That's great. Yeah. Thank you.
You're welcome. Another question or suggestion, please? We have some expert here about climate change and NCD. We don't be hesitate to ask or question or give a suggestion for our projects, for next projects. No? I think we finished for, the team C. I think the team B is finished. Please give applause for presenter. And last but not the least, the team C with the presenter from the institution, right? Okay. Please, time is yours. Professor Adi Utarini, you have more than 30 minutes. You can go slowly. And I think we have until 10 o'clock.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I would do it as quickly as possible so that we have more time to discuss, because I believe for this topic all of us would have thoughts and further actions and plans related to this. So for Group C, only the two of us are present today, myself and Bu Retno. Next please, Mas Nandi. Yeah. We have Prof. Helmi, Prof. Sukisno, Pak Budi, and then Prof. Sri Raharjo, Bu Ika from the university level, and then myself and Bu Retno from the Faculty of Medicine, and then Bu Endang from the Faculty of Biology. What we will present is related to the principles in the consortium, as well as we also try to make it more concrete on what the format of the consortium, and then finally some key points and some actions for all of us. Yeah. The principles, we discuss about these points that need to be shared and to have common understanding between the 5 universities. Number one, we agreed that why we form this consortium is really based on collegial relationship and trust among the 5 universities in Indonesia and also with partner universities in Germany. So this is very important as the foundation, that later on, whatever the consortium decides to do, activities are really of mutual decision making by the consortium members. And then we also discuss a lot about how this consortium would function in a way that the consortium should help the members for the members to pursue their own strengths, because each of the member university, I believe, has their own strength. For example, maybe UNSUD already has strength on climate change, climate health, and the same with other universities. And through the consortium, we hope that each of the excellencies and strengths can be sort of brought up in a higher level. And from the beginning, we also discussed that I think the core activities of the consortium would be facilitating research and discussion. And by saying this, we discussed because to do a proper research, we may need a large funding. And to get a large funding, maybe this will not happen in very quickly. It would take time to develop a proposal and get funding for research. But what we can do in the beginning is to facilitate the research and publication itself. For example, through conducting workshops, so that at the end of the workshops we could have high quality proposals, or workshops to support publications and writing among the 5 members of the consortium. Slide before. Yeah. Number 3 is sustainability, and this group really highlights that when we talk about sustainability, we should talk about from the financial as well as non-financial aspects. Now, from the financial aspects, I think it's already clear, and I'm sure we all understand very well about this. But also the group discussed about non-financial aspects to sustain the consortium. And yesterday we discussed the example of setting up a journal, for example. This is one way to sustain the consortium. And then equal opportunity, equal recognition, and mutual decision making. I think this should be the principles to run the consortium itself, and how the secretariat relate to the 5 members of the university. Last but not least, we are not thinking of a bulky structure, but we want to have a slim structure, but yet it should be as effective as possible. So minimum structure, but maybe very rich in its functions, and also produce what we expect: publication, journals, etc. Next, yeah. This is also discussed from the beginning, and I myself feel that yes, this must be achieved. At the same time, this is also not very all the difficult, all the challenging, not difficult, yeah, all the challenging. But at the same time, this is what we need as a lecturer. We need to publish. We need to do research, and we need also to develop our expertise to be an experts. And clearly, the consortium should also, from the beginning, set up these indicators. What are the indicators that this consortium aims to achieve? So later on, maybe we should also try to put numbers in it. For example, how much publication do we aim to produce in the first 5 years, 10 years, and so forth. Also, the amount of research grant obtained, I think this is also very important indicator. If we all succeeds to attract many research grants, then it really proves that this consortium is effective. Last but not least, yesterday Professor Rayner also presented these courses that you organize in Africa, in different parts of the world. And I'm glad to share that the Faculty of Medicine is also a member of TropEd, and we also offered courses at least once a year, but sometimes we also offered courses in summer courses. So I think through this consortium, at least one of the universities are already a member of TropEd, and so it's this is one way to start concrete activities. Next, please. Yeah. Some of the key points about the organization, and please, Puratno, also correct me, and if I have to be very careful in saying this. Number 1, the group agreed to use the term consortium on global health, and this is, of course, the inter-university consortium on global health. And the vice rectors in the group advised that to have the consortium at the university level, so that each university will have the flexibility within the university. And maybe this is considered to be very important in the beginning, and also to to have the commitment of the university from the beginning. And then my understanding was that for the preparatory phase, we were asked to lead the consortium, in which the consortium then would have the steering committee, the organizing committee, and the secretariat of the consortium. Next slide. Now, this is what we discussed so far, that the steering committee should consist of rector of the 5 universities, ex officio, so it can be represented by the vice rectors and deans. And then donor agencies, industries, we were thinking of CSR scheme for example, pharmacy industries, and also international agencies, CEMOLEC, of course, and then representative of the German universities. I'm not sure whether it should be also all from all German universities involved in this consortium, or representative of German universities is something that we could discuss and ask comment from Professor Reiner. For the organizing committee, in UGM, we will appoint the coordinator and the secretariat at the university level. And then we hope, and maybe this is already appointed actually, that from each university we will have the person in charge from each university. Next. Now, some of the key tasks of the consortium secretariat and also tasks from the individual universities are already discussed, but I'm sure the list maybe can be either shortened or or make it longer. But what we mentioned yesterday was that number one, the secretariat should really finalize the proposal. I think we hear this proposal finalization several times, but as far as today, I think we still receive many inputs. And also the organization of the consortium itself to be discussed. And then number two, advocacy. Once the consortium is set up and then the proposals are submitted, then we should also plan to do advocacy to key stakeholders. And the name brought up yesterday was Professor Kuntoro, a very important key person, and also from Ministry of Health and Kemenristek. And along the way, the consortium needs to facilitate discussion with funding agencies, and this is through the networking of the consortium members, because I believe each university has its own strong networking, as well as the consortium. And then finally, facilitate activities to respond to opportunities from CEMOLEC, because yesterday we heard that the posts for PhD, for example, are not well absorbed, still absorbed very low. So perhaps the consortium could also try to facilitate how we can improve the number of PhD candidates, master candidates, either through a scheme of double degree or through just encouraging, identifying potential individuals and then to be sent to Germany. And then the exit strategies was also highlighted. Now these are the consortium secretariat, and there are also hopes and expectations for the individual members for the 5 universities. Number one was stated quite clearly that the university need to show that they are committed to this theme, global health, and the way to show the commitment is through co-funding, especially in the beginning phase. 2 things. First, pre-financing, of course, the participants to attend our meetings. And number 2, more importantly, for each university to link whatever existing funding scheme that they have with their own funding, how they can make this flexible and then to support the agenda of global health research. Another task, I think this was already discussed, and perhaps it's already clear also that each university has a person in charge, and then each university also has its own strength and excellences. Next. I think this is my last slide. Some immediate actions that need to be done. First is, of course, the proposal need to be submitted to Siamolek. And correct me, Pak Budi, if I'm wrong, that I think the deadline for that is on May, is that correct? Yeah, so by May, we really need to make up our mind and propose and just submit the proposal. And there are few things to be done also from the legal aspects as well as operational aspects. From the legal aspects is to get the MOU signed by 5 rectors, and at the same time launching this consortium in global health, and perhaps also we could invite Prof. Kuntoro at that moment. Organization structure of the consortium need to be agreed among all of us. Steering committee, secretariat, and then PICs from each university. Yeah, I think this is all what we discussed. Bu Retno, would you have something? Yeah, it's all there. Okay, yeah. Thank you, Pak Wisma. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Adi Utaringningsih. Is there any question or suggestion for the presentations, please? Anyone agree? Everyone, no one.
It's very important and very good that you create a formalized contract, like a memorandum of understanding between all of you. I wonder how the formal agreement should be between the center or the consortium, sorry, and the German partners. Would there also be a memorandum of understanding, or would you just mention that there will be some cooperation with these entities in Germany? Should we formalize this, or is it for the moment mainly the Indonesian side that gets formalized and organized? It's just a question.
It's a question to all of us, ya, Pak. I myself cannot. Mungkin peserta juga. We haven't discussed in the group yesterday, Bu Retno. We didn't really discuss about that. It's more of the agreement between 5 universities, but I fully agree that needs to be also thought. Yeah.
Yeah, please.
And just to share, in the previous meetings, Pak Budi, correct me, in the last meeting that we had here, we actually discussed it a bit about what to do with the German partners, and it was supposed to be discussed with Siamolek, but unfortunately Pak Agus is not here at the moment, but we were discussing several possibilities, whether it will be MOU between the consortium and all 5 partners, or is it with just one representative as the coordinator, so the details are not yet discussed, but it's something which needs to be formulated before the May proposal that we need to clarify. So we hope to discuss it with Siamolek, how is this going to arrange with Germany? Or is it between the DG here and the DG in Germany? That's another possibility that we discuss, because if it's between minister and minister, that's another scheme which would be, that's beyond us. Yeah, but that's not, we should, I mean, we opted for something more simpler, but all these possibilities are on the table and we haven't really decided on anything.
Yeah. Okay.
I think he mentioned to me that he will come again on Saturday. So I think one of us could probably ask him further about these issues. Yeah.
Okay. Any question or suggestion? I think so. We have so many work. Please, Professor Rika.
Yeah, because the due date is tanggal berapa, Pak? Berapa Mei? Pak Budi? Early or what? Oh, May. But it means that the MOU should be before the due date of the proposal submission. Yeah. 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 I think, and Professor Renir can be liaison officer between 5 institutions, that I think. have been contacted by the Siamolek team before. Heidelberg, DKF, yeah, German partners, yeah.
Okay.
May I ask, Prof, in your opinion, what would you suggest? What would be better?
I think if it comes to proposing something to ministers, it's always going to be clear. And so I think they would appreciate any degree of commitment. Otherwise, I would think we would be looking for parts of the German area and really talk to them. I think it's better to show them that yes, here we understand how the Germans are organized, and we are proposing how to work with them. We have a steering committee among the 5 of us, and then we have an overall coordination committee which meets us every month or so. I think one should give some thought to how you are organized here and then how they all is going to work. Otherwise, I think it will then work too complicated with the 5 partners here, 4 partners here in Germany. How are they going to make this happen? So I for something of structure and procedure also in the partnership relationship. But
Yes, so many items must be discussed, and it is hard work for the team member to make the proposal and submit on May.
in charge of one person.
Yes.
Anything by committee is very difficult. And if you don't have one person who my job, I will bring in everybody to think, but it's my job to keep the deadline, it's my job to get all the pieces together, it's dangerous.
Yes.
This is always, it's so nice to have many institutions, but it's also a problem in that the kind of structure that they've done is not there. If it's only one faculty or one university, it's easier to find. I would suggest that you appoint a manager or somebody who has the mandate to ask
Personal in charge.
and certainly
Yeah, I see.
what's needed by tomorrow.
Yeah.
Otherwise, I think it will be very difficult to get everybody on board and get it done at the right time.
It's a secret, pa. No. No. In the closing session, I'm just trying to say, because this is coordinated by the university, and perhaps it's not under my capacity really to inform about this, but hopefully in the afternoon session they will let all of us know. But definitely we are aware of the need to have sort of one coordinator and just few, maybe one secretary with good secretarial backup and funds by the university to get this going, to get this moving on the steps. Yeah. But hopefully later on it will be disclosed to the meeting. Because and it's already said by the university that the secretariat will be at the university level, but then they will delegate the task. I think the task itself will not be implemented by university, but delegated at the lower level, And in UGM, this would involve several faculties, so not just the faculty of medicine, but we also have biology, and we also aim to involve the Center for Environmental Studies that we have in the university. So they have one person in mind already. Yeah.
Okay, I think the nice discussions. Thank you very much for Professor Adi Utareningsi. Please give an applause for Professor Adi Utareningsi. I think for our discussion for this session, the conclusion will be read by the Secretary, please.
Thank you. However, I can say that this is a conclusion. It's just let us be informed that the result of the discussion from those three groups would be the information for us to improve the proposal before we submit it to Bapanas on May. So after this session, or after the meeting today, I believe that we need to communicate more, considering the time is very short due to the due date. So I think that we need to have this material, all of the team members, so we can contribute more in improving the proposal. I think that's we have from this discussion. Thank you.
Okay, thank you very much. Thank you for all of us that discuss for this in these sessions. Thank you for very much the time and I give to the organizer. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Dr. Wisma and Ibu Eri for having led the presentation and the discussion. Honorable guests, ladies and gentlemen, for the next 20 minutes, we will have a coffee break, a short coffee break. So you are welcome to enjoy the meals and drinks which have been served outside this room. And after 20 minutes, we will continue the next session, the comments from Professor Rainier Soburn. Thank you.